In 2019, a quiet suburb in Ohio became the center of a massive healthcare fraud investigation that stunned patients, insurance companies, and even seasoned federal prosecutors. At the heart of the scandal was Dr. Samuel Parker, a well-regarded internist who had been practicing medicine for more than 2 decades. On the surface, Parker's clinic looked like a model of efficiency, short wait times, friendly staff, and glowing reviews from patients. But behind the polished exterior, investigators later discovered, was a scheme designed to milk millions of dollars from Medicare, Medicaid, and private insurers. It started with small, almost invisible adjustments to billing codes. Parker began upcoding routine visits, billing, a 15-minute consultation as if it were a complex hour-long examination. Over time, he instructed his staff to submit claims for procedures that were never performed. Lab tests, EKGs, even minor surgical procedures. In some cases, entire phantom visits were billed for patients who hadn't set foot in the office. For patients like 72-year-old Nancy Johnson, the fraud only came to light when she received a Medicare statement showing she had supposedly undergone a stress test and pulmonary function study. Nancy had never had those tests. Alarmed, she called Medicare and filed a complaint. Hers wasn't the only one. Within months, a pattern emerged. Dozens of elderly patients were being billed for the same unnecessary or non-existent procedures. The case was referred to the Department of Health and Human Services Office of Inspector General, HHS OIG, and the FBI agents quietly pulled records, cross-checking billing data with patient files. What they found was staggering: over $8.4 million in fraudulent claims over a 6-year period. Some patients had been billed for hospice care while still living independently. Others were listed as receiving injections of expensive cancer drugs they never needed. When federal agents raided Parker's office, they seized computers, billing records, and even pre-filled claim templates. Former employees later testified that Parker pressured them to find ways to increase revenue, threatening to cut hours if billing numbers dropped. One whistleblower described the culture of fear. "We all knew it was wrong, but he kept saying, 'This is how everyone does it.'" At trial, Parker's defense argued that billing errors were common in medicine, and that mistakes had been exaggerated. But jurors weren't convinced. In 2021, Parker was convicted of healthcare fraud, wire fraud, and aggravated identity theft. He was sentenced to 12 years in federal prison and ordered to pay restitution. The fallout went beyond Parker himself. Patients felt betrayed, wondering if their trust in their doctor had put them at risk. Insurers tightened oversight, flagging unusual billing spikes earlier, and the case became a cautionary tale in medical schools and compliance seminars nationwide. For Nancy Johnson, the patient whose complaint helped spark the investigation, the outcome was bittersweet. "He was my doctor for years," she told reporters after the sentencing. "I trusted him with my health. I never thought he'd use my name just to make money." The Parker case underscores a hard truth. While most doctors are honest and dedicated, medical billing fraud is a billion-dollar problem in the U.S. Each fraudulent claim not only drains taxpayer funds but also erodes the fragile trust between patients and providers. And as regulators warn, vigilance from insurers, patients, and medical staff alike is the only way to stop the next ghost patient scheme before it spirals out of control.